Welcome to the Menopause video series by your GYN NP. Women have many questions about hormone replacement therapy. Be better prepared to discuss HRT with your healthcare provider. Your GYN NP's Managing Menopause video series is going to review the science and the facts. Hormone replacement. Do you know the pros and cons, the risks and benefits? Before we proceed, you need to know: why are some women prescribed only estrogen? Why are other women prescribed estrogen plus progesterone or progestin, a synthetic progesterone? Answer: if taken alone, estrogen often causes cancer of the uterine lining, endometrial cancer. Combining progesterone with estrogen prevents this increased cancer risk. What if I've had a hysterectomy? If you've had your uterus removed, then estrogen should be taken without progesterone because there is no uterine lining to protect from cancer. Important: estrogen alone has fewer risks than estrogen plus progesterone. Do you know 5 benefits of menopausal estrogen replacement? Estrogen helps to prevent night sweats and hot flashes, osteoporosis, vaginal dryness, painful sex, urinary frequency and urgency, bladder infections. Bonus benefit of estrogen replacement: improvement of perimenopausal brain fog and/or irritability. Good news, this symptom resolves in 1 to 2 years even without estrogen replacement and is only experienced in relatively few women. Do you know 7 increased risks of estrogen plus progesterone? Number 1, breast cancer after 3 to 5 years use. Number 2, stroke after 5 years use. Number 3, blood clots if estrogen is taken orally. Number 4, poorer survival rate of lung cancer, which is not the same as higher risk of getting lung cancer. Number 5, decreased memory if over age 65. Number 6, ovarian cancer, small increased risk after 10 years. Number 7, heart disease, heart attack if HRT is started 10 or more years post-menopause, or if heart disease, stroke, or diabetes was already present when HRT started. What if I've had a hysterectomy and am taking estrogen alone? Answer: estrogen alone has less risk than taking estrogen plus progesterone. Number 1, estrogen alone has less risk of heart disease than estrogen plus progesterone. Number 2, estrogen alone does not increase risk of memory problems as does estrogen plus progesterone. Number 3, estrogen alone has less stroke risk than estrogen plus progesterone. Number 4, estrogen alone has little or no increased risk of breast cancer compared to estrogen plus progesterone. About blood clot risk. Estrogen taken orally has an increased risk of blood clots, but estrogen taken topically, through the skin, or vaginally does not have a significant increase in blood clot risk. Safety reminder: never use estrogen without progesterone if you still have your uterus. There is a significant risk of developing cancer of the uterine lining. Bonus information: if you only use estrogen for prevention of urinary frequency and urgency, bladder infections, vaginal dryness, then be sure to use an estrogen made to be used vaginally. This will avoid the risks of systemic HRT. Definition: what is systemic medication? Systemic medication is medication taken orally or by patch, cream, mist, or gel, and therefore has both risks and benefits that affect the entire body. Safety message: before starting hormone replacement therapy, always remember to ask your healthcare provider: do I have any medical history that would make these prescriptions an unacceptable risk? Take-home message: the North American Menopause Society advises women under 60 years old and less than 10 years into menopause may consider starting hormone therapy in order to treat menopause-related symptoms, to prevent osteoporosis in women at high risk of fracture. Why does NAMS recommend this? Because the risk of starting hormone therapy 10 or more years after menopause and at over 60 years of age has been shown to increase risk of heart attack. Health choices are never simple, but now you have some facts to help you sort out the confusion and feel better soon. Share your GYNNP.com with your friends and family. They will thank you.